Today I'm going to be talking about states of consciousness. And when we talk about states of consciousness, we're actually talking about just general consciousness, which is a term that more or less refers to an organism's awareness of both itself as well as its surroundings, and the different states of consciousness that we pass through. So, for example, sleep is considered a state of consciousness. It's not a state of unconsciousness, although that could be considered another state of consciousness if you're unconscious, meaning that you were knocked unconscious by a blow to the head or a concussion, for instance. But when we talk about consciousness, we're generally talking about awareness, and so we actually transition through different states of consciousness throughout our day and as well as throughout our night. And that's what we're going to be talking about in this lecture here. So, as I said, consciousness can very broadly be defined as an organism's awareness of its own self and surroundings. Now, interestingly enough, an organism's awareness of its own self it appears to be limited to just a few species. Obviously, humans are one of those species. Chimpanzees, our closest living relatives, are most likely the second species, and a third species that has considerable evidence in support of its existence of what we often refer to as self-awareness, the ability to conceive of oneself, is the orangutan. Now, the other two species that have been investigated, there have actually been many more than two species investigated, but the other two species that seem to have additional evidence are the elephant and the dolphin. And when I talk about evidence for self-awareness, what we're actually referring to here is the ability of an organism to become the object of its own attention in a mirror. Okay, that's actually the most common way of assessing for self-consciousness in a species. So, for instance, if you see yourself in a mirror, you would recognize yourself. But if your dog saw itself in a mirror, and this is a bit of a controversial saying, not because of the empirical evidence being controversial, but more so because of the fact that we, as human beings, tend to love dogs very much and would like to think that they are aware of themselves. But in fact, there's not any good evidence that I'm aware of that indicates that they are. So in these other species, there's been a test that's been developed. It's now called the Mark test, and it involves placing a spot of red dye on the organism, usually above its eyebrow, for instance, where it couldn't see that spot without the use of the mirror. And if the actual test itself is to see whether they recognize that the spot is on their own forehead or not. And of course, as I mentioned, they can only identify that spot through the use of the mirror because it's placed in such a location where it's not able to be observed without the use of a mirror. So if they recognize that the image in the mirror is themselves, then they would go ahead and touch the spot. And so, like I said, chimpanzees are the species that most reliably passes this test. Orangutans do as well. And then there's a little bit more controversial evidence and less evidence, really, in support of the existence of self-awareness in dolphins and elephants. So that's what we mean when we say awareness of one's own self. In terms of awareness of surroundings, obviously many organisms other than those five that I just mentioned are aware of their own self, of their surroundings, that is. So as I mentioned, altered states of consciousness is also investigated under the broader topic of consciousness, and this refers to mental states that are found during sleep, dreaming, psychoactive drug use, hypnosis, and so on. So, as I said, other than being awake, two of the more common states of consciousness are really sleep and dreaming. So, as I said, you're not really in an unconscious state while you're asleep, but rather in an altered state of consciousness. And so it's clear then that our level of awareness can vary. As I said, we could be awake or we could be asleep, but we can really conceptualize this as a dimensional uh, uh, model of awareness where our awareness of ourselves and our environment can be very low. For instance, if we're in a coma or under the effects of anesthesia, we generally have no awareness of ourselves. Whereas if we're in different stages of sleeping, our awareness is more limited, but it's not at a low level, such as in the case of anesthesia or coma, because we can't be awoken from those states. Uh, Normal or middle awareness, you could think of this as sort of the automatic processing for activities that require minimal attention, such as just walking and talking on the phone. Basically, things that rely on something that we refer to as implicit memory, which we're going to be talking about in a lecture down the road here. And then, of course, higher levels of awareness are characterized by use of something called controlled processing. Controlled processing meaning that we really need to exert a lot of effort, and these are activities that require focus, maximum attention, such as learning how to do something for the first time, or studying for an exam, for instance.
So, as I mentioned, sleep is a state of awareness, and it's also an example of what we refer to, what researchers refer to as a circadian rhythm. Okay, circa meaning about, dia meaning day. About the day, we go through these rhythms. Okay, these are actually biological changes that occur on more or less a roughly 24-hour cycle, and our alertness seems to follow this cycle pretty nicely. That is, we are at our peak level of awareness in the late afternoon, and then as the night gets later, we tend to drift off into sleep, and then we wake back up in the morning. Our level of awareness increases, and then it goes back down. So you can see that roughly every 24 hours or so, we complete one full cycle. And interestingly enough, our changes in body temperature, they tend to follow a very similar trajectory to that of our level of alertness. And this is no coincidence. It's in large part uh, um, um, in large part controlled by various structures in the brain, some of which we can see here. Two of the more important ones in terms of regulating our level of arousal and sleep include the pineal gland, located right in the middle of the brain, because this is a gland, a structure in our brain really, that secretes a hormone called melatonin, as well as another structure in our brain located anterior to that, meaning in front of, called the suprachiasmatic nucleus. And what happens is light that travels through our eyes gets the signals from that light through our optic nerves and whatnot get carried on to those different structures that I was just referring to, and it helps our brain to regulate our level of alertness primarily through changes in light. So now we're going to talk about sleep. First of all, most people are familiar with the effects of sleep deprivation. In fact, if you go 72 hours without sleep, that often leads to brief second-long sleeps called microsleeps. But of course, as I said, most of us are familiar with the effects of sleep deprivation, especially being in an academic environment. The sleep deprivation can lead to significant mood alterations, decreased self-esteem, reduced concentration, reduced motivation, increased irritability, lapses in attention, reduced motor skills, and increased stress hormones, in particular cortisol. And as I said, there's an abundance of evidence in support of these effects. So sleep deprivation is a real serious problem. One thing that you may not know about sleep is that sleep is not a unitary altered state of consciousness. That is, there are actually different stages of sleep, and one of the ways that we characterize these different stages, so one of the ways that we study them is through the use of EEG. So if you recall, EEG is a technology. It stands for electroencephalogram that that involves the use of electrodes which has wires connected to them. It detects and records the electrical activity of our brains and by being passed through the skull. And these small electrodes can measure oscillations in brain activity, in electrical activity of the brain. So the first thing we see here is that in our awake state, and as we progress from awake into deeper and deeper stages of sleep, that is, becoming drowsy and then moving into stage 1, followed by stage 2, and then 3 and 4, what we see is in awake and alert states, we tend to have low amplitude, high frequency waves, which are called beta waves. Okay, beta just refers to the frequency of the waveform. When we become a little drowsy, but we're still awake, we tend to see the frequency of the waveforms decrease a little bit and the amplitude increase a little bit. And these waves are called alpha waves. So this is what you see when you're drowsy. It's very similar to induce your brain to display more alpha waves and beta waves, because all you have to do is just close your eyes. When you close your eyes, you've just decreased a significant amount of stimuli that are entering into your brain for you to process, and so you automatically become less aroused because of that and more drowsy. And in stage 1, again, we see the same pattern. We see a reduction in the frequency of the waveforms and an increase in amplitude. At this point, stage 1 sleep is characterized by the presence of waves called theta waves. In stage 2, again, the primary means of differentiating these two stages of sleep, at least using EEG, is a continuation of this pattern. But in addition, we also see these large amplitude changes, which are called sleep spindles. And finally, as we get into stages 3 and 4, which are termed deep sleep, these are the highest amplitude waveforms that are known as delta waves, and they are of the lowest frequency. Excuse me. So we pass through these different stages of sleep. There used to be considered to be 4 different stages, but because stage 3 and 4 were not all that easy to differentiate, the American Sleep Society had decided that stages 3 and 4 would be combined, and now it's really just known more as deep sleep. So as we progress from awake to stage 1, to 2, to 3, to 4, what happens after this is we return back in reverse order to the previous stage. We typically don't reverse back to our awake state because we usually don't wake up in the middle of the night unless there's some reason to be woken up. But we do go from 1, 2 to 3 to 4, and then back to 3 to 2. And then when we go back into 1, we see that instead of actually going into stage 1 sleep, we go into an entirely different stage of sleep, which is called REM sleep. So I didn't mention this, but the first 4 stages, 1, 2, 3, 4, are called non-REM. REM is a different stage of sleep characterized by the presence of rapid eye movements. Rapid eye movements, that's what REM stands for. These are low voltage, high frequency waves, and guess what they look like? They look a lot like the brain waves that we see when we're awake. So it turns out that REM sleep is usually characterized as a very active stage of sleep, and it's the stage of sleep where we have our most vivid dreams. It's the stage of sleep where we do the majority of our dreaming. So we're going to talk about dreaming, but some people remember their dreams, some people don't. Some people tend to remember them more often on some days and not at all on other days. And the primary determinant of whether you remember your dreams, among a number of other things, is if you're woken up during REM sleep, you're more likely to report that you were dreaming. And as you can see, we spend more and more time in REM sleep as the night goes on. That increases the likelihood that when we go to wake up, we are going to wake up during a stage of REM sleep. And so that's why it's not uncommon for us to remember our dreams. But of course, some people do report that they don't. Um, it's highly unlikely that they do not dream at all. It's much more likely that they just don't remember their dreams. And to test that out, of course, what you could do is you could watch the person while they're asleep. As soon as you see their eye movements start to change underneath their eyelids, or if you're measuring them with EEG, you can tell that they're in REM sleep. You go ahead and wake them up. Most likely, they're going to report that they were dreaming. So as I said, there's REM sleep and there's non-REM sleep, and one of the interesting things about this is that the proportion of time that we spend in these three different states, REM, non-REM, and awake, varies throughout the lifespan. So as we can see, and as anyone who has an infant is very familiar, they spend the majority of their time not in the awake state. Okay, that is, in the majority of their time, they're actually in REM sleep. Again, this is a very active stage of sleep. It's probably very important in terms of infant brain development. They also spend a large proportion of time in REM sleep. As adults, we tend to spend much more time awake and a smaller proportion in REM sleep in comparison to non-REM, but still it's about roughly half the time. The other thing that we could see in that chart on the previous slide was that we tend to progress through these stages in 90-minute cycles. So we go from 1, 2, 3, 4 to 3, 2, and then REM. That's about a 90-minute cycle to complete that cycle there. The other thing about REM sleep is that it appears to be important for learning and consolidation of memories. We know that it's a pretty important stage of sleep because if you selectively prevent people from going into REM sleep, again, because we can record their EEGs, we can tell exactly when they go into REM sleep, so we can allow them to sleep a normal amount in the non-REM stages because we never wake them up in those stages. We only wake them up in REM sleep every time they start to go into it, so they never get any REM sleep. And if you do that for one night, the next night you measure how much time they spend in REM sleep, and they spend additional time in REM sleep. This is a phenomenon that's known as REM rebound. Okay, so as I mentioned, non-REM is stages 1 through 4. Stage 4 being the deepest level of sleep. When we say the deepest level, we mean that it's the hardest to wake you up from that stage. And also, if we do wake you up, you will be very confused. Okay, if we wake you up during stage 1, on the other hand, your level of confusion will be much lower. In fact, psychologists have done studies where they'll wake you up in these different stages, ask you to do some math problems. You can add, simple addition and subtraction problems, no problem when you're immediately woken up from stage 1. But when you're woken up from stage 3, that same task becomes stage 3 and stage 4. That task becomes much more difficult. And finally, as we approach older age, we are sleeping less overall, but we continue to show a reduction in the amount of REM sleep that we're getting. So why do we sleep? Okay, we know that we need to. We know that you can only stay up for a finite amount of time before you absolutely must go to sleep. But the question of why we sleep, that is a much more controversial topic. In fact, there have been, as you can see here, a number of different theories that have been proposed to explain why, although no one theory seems to be capable of explaining altogether why we sleep. The adaptation protection theory proposes that sleep evolved to conserve energy as a protection from predators, and also serves as part of this circadian cycle that we talked about. So, given that we are diurnal organisms, we function best during the day. It might be advantageous for us to be asleep at night because we would be more likely to injure ourselves, and we're just less capable of functioning without the use of light. The repair restoration theory suggests that sleep serves as a recuperative function, allowing organisms to repair or replenish key factors. Growth development theory, as we just saw, sleep coincides with with growth, and in particular the release of growth hormones from the pituitary gland. And we saw that we need less sleep as we age. That could be related to the fact that we're growing less. And the other thing that I pointed out earlier as well is that sleep is very important for learning and the consolidation, storage, and maintenance of new memories. So consolidation, storage, and maintenance are different processes that memories must go through in order to be maintained, and that's something that we'll talk about a little bit later on. Now, why do we dream? Again, another very controversial area in the sense that we don't know what purpose dreams serve, but we do know that just about everybody dreams, and that it's very uncommon for somebody to not report ever dreaming, particularly, as I said, if they're woken up during REM sleep. So a couple different theories. One is wish fulfillment theory. This is sort of a Freudian type of theory that does not have a whole lot of scientific support, but you may hear terms such as manifest and latent content of dreams, and what these just refer to is manifest content refers to the surface story of the dream. Okay, it's what you're actually dreaming about. So if you dream about flying, then that's the manifest content. The latent content is the unconscious hidden meaning, which is much more open to interpretation and is much more subjective and more difficult to demonstrate empirically. So if you have the manifest content that you're dreaming, the latent content would be what is the meaning behind you dreaming that you're flying? What does flying mean for you? Maybe it means that you feel unsecure, like your feet are not on the ground, and that you are not getting any traction, that you are not certain where you're going, for instance. Okay. On the other hand, a biological type of theory called the activation synthesis hypothesis suggests that random activity in your brain is being interpreted by your brain. Random activity in one area is interpreted by higher levels, and that's what gives you the experience of dream. A more cognitive perspective, on the other hand, suggests that dreams allow us to process and assimilate and update information in our brain. This is actually a theory that has some of the stronger evidence, in part because of the similarities between the things that we dream about and the things that we think about when we're actually awake. So unfortunately, sleep disorders or problems with sleep are a major problem in this country. And in fact, there are a number of different sleep disorders. The one that most people are probably most familiar with are the dysomnias, in particular insomnia, which refers to a persistent difficulty either falling asleep or staying asleep or waking up too early. Any one of those three. And dysomnias, in contrast to parasomnias, are characterized by disruptions in the normal sleep process. Okay, parasomnias, on the other hand, are more characterized. They're disruptive sleep disorders in the sense that they're characterized by undesirable physical or verbal actions. For instance, walking or talking during sleep. So narcolepsy, another type of dysomnia, is the sudden or irresistible onset of sleep during waking hours. It's characterized by sudden sleep attacks while either standing, walking, or even driving, and they tend to be more easily induced, interestingly enough, or ironically enough, I could say, during a person's state of heightened arousal, when they're having a laughing episode, for instance. And then sleep apnea, another common problem, is the repeated interruption of breathing while asleep, which often causes loud snoring or poor quality of sleep and can actually result in an individual having numerous episodes in which they just stop breathing temporarily. Nightmares, as I said, are types of parasomnias. Parasomnias being undesirable or abnormal physical or verbal behaviors. So, things like bad dreams during REM can significantly disrupt sleep for some people. nightmares, night terrors are abrupt awakenings with feelings of panic and they occur during non-REM sleep. Also, they can significantly disrupt sleep. They're not the same. First of all, night terrors typically occur in children. We typically outgrow them, and they can be extremely frightening for an individual. Other types of parasomnias can include sleepwalking, as well as sleep paralysis, which is when a person is not able to move their body or limbs when falling asleep or waking up, as well as sleep enuresis, which is just a technical name for bedwetting. Those are all examples of parasomnias. Okay. Fortunately, there are a number of things that we can do, particularly behavioral things that can help us to fall asleep. One, of course, being exercise, not necessarily right before bed, but exercise does help people maintain a more regular sleep cycle. The avoidance of stimulants, again, particularly late in the day, like coffee, avoiding late meals and heavy drinking. For instance, some people might think that drinking helps them fall asleep. Well, it may help them fall asleep, but the quality of the sleep, again, in terms of the different stages of sleep, is not as good. Worrying can make it difficult to fall asleep, and also engaging in pre-sleep rituals. That is, always doing the same thing right before you go to bed can help you get into a habit of falling asleep. When you're in bed, using a relaxation technique called progressive muscle relaxation, which involves the systematic tensing and releasing of different muscles, yoga, using fantasies, deep breathing, or even a warm bath are all things that you could do to help you fall asleep. So as I said, even though many people turn to medications first for psychological and psychiatric types of problems, it actually turns out that behavioral solutions are much safer and equally, if not more, effective most of the time. Okay, so now we're going to talk a little bit about some psychoactive drugs that are capable of influencing our state of consciousness as well. But before we begin talking about the psychoactive drugs themselves, it's important to just become familiar with a few terms that are used in the context of using psychoactive drugs, particularly illicit or recreational types of drugs. So drug abuse refers to drug taking that causes emotional or physical harm to either the drug user or others. Okay, so that's really what drug abuse is. It's the ingestion of a substance that causes emotional or physical harm to the user or someone else. Addiction is a broader term which describes a compulsive a pattern of drug use for a specific drug, or even for a certain activity. We can become addicted to other things other than drugs. Sometimes they may not be particularly bad things. For instance, you could become addicted to exercise. On the other hand, you could also become addicted to eating, which could be more problematic. Typically, there are two different types of dependence that are talked about in the context of drug use. Psychological dependence, usually refers to more of a mental desire or a craving to achieve a drug's effect. Although that's a little bit more controversial than the physical dependence, which refers to changes in bodily processes that make a drug necessary for minimum daily function. And this can be seen primarily through withdrawal symptoms. Okay, that is, we can tell that somebody is physically dependent based on the fact that they show physiological withdrawal symptoms. The withdrawal symptoms can include discomfort and distress, such as physical pain, intense cravings, nausea or vomiting. They're typically the reverse of what the effects of the drug are when it's actually being ingested. So when an individual hasn't had a drug, whatever the symptoms of the drug use were, or the effects of the drug were, the opposite effects can be expected to occur in the absence of a drug when somebody has become addicted and they're experiencing withdrawal symptoms. Another term Tolerance refers to the bodily adjustment to higher and higher levels of a drug, which leads to decreased sensitivity. And there are actually different types of tolerance as well. There's a behavioral tolerance, which refers to the fact that the more experience you have with drinking alcohol, for instance, the less disrupted your coordination can become, even at the same blood alcohol levels. Okay, or alternatively, there's a physiological tolerance where you just metabolize a drug more quickly. And we can also see a phenomenon referred to as cross tolerance, which is when using one drug increases the tolerance for another drug. So in terms of the neurotransmitter systems and how drugs actually exert their effects, okay, because in order for a psychoactive drug to have a psychoactive effect, it has to have some effect on our nervous system and in particular our brain. So drugs can be classified as either agonistic drugs or antagonistic drugs. I believe that we talked about this at least briefly in the context of neuroscience and the biological basis of behavior, but agonist drugs are once again drugs that enhance synaptic transmission, particularly for the neurotransmitter molecule that they are having their effect on. So in one sense, agonist drugs, they can increase a neuron's ability to either synthesize more of a transmitter molecule or increase their ability to store that molecule, or even to release them. All of those would be considered agonistic effects at the level of drug synthesis, storage, and release. They can also have an agonistic effect at the level of binding, where some drugs just have similar shapes, which allow them to bind with receptor sites that mimic the neurotransmitter's messages. For instance, LSD, the hallucinogenic drug, lysergic acid diethylamide, is structurally similar to the molecule serotonin, and so it's which is a neurotransmitter that's normally received by neurons in our brain. It can actually mimic serotonin, and we can also have drugs that impact deactivation. We talked about de-enzyme activation, which is a process by which after a neurotransmitter has plugged into a receptor site, it gets released and then it gets broken down through enzymes, and that's called enzyme deactivation. So if we block the deactivation of these neurotransmitters, then we essentially make more neurotransmitter available, therefore increase its effect, therefore it's an agonist. Antagonist drugs, they can also affect similar levels of processing of neurotransmitters, but just generally speaking, antagonistic drugs inhibit synaptic transmission, or they reduce the effect of a neurotransmitter. Okay. Now, in terms of different classes of drugs, we could sort of characterize different types of psychoactive drugs into different categories. One category being depressants, or we might call them sedatives as well. This includes specific drugs such as alcohol, barbiturates, anxiolytics, which are typically barbiturates, or benzodiazepines more likely. All those things are depressants, and the reason that they're depressants is because they tend to depress the nervous system. That is, they tend to reduce neural activity. Stimulants, on the other hand, tend to have the opposite effect. These are drugs such as cocaine, amphetamine, methamphetamine, or ecstasy, or MDMA, and these are drugs that typically have the effect of exhilaration, euphoria, high physical and mental energy, and they exert their effects by usually agonizing neurotransmitter systems such as dopamine and norepinephrine. Caffeine and nicotine, these are also considered to be stimulant drugs, but they have impacts on different receptors. In fact, nicotine acts on acetylcholine via a receptor that's named after the substance called the nicotinic receptor. Opiates, or narcotics, these include drugs such as morphine, heroin, codeine, or OxyContin. They primarily exert their effect by agonizing the endogenous morphine system, uh, which are referred to as endorphins. Um, and hallucinogens are drugs that, as the name might imply, are capable of, especially particularly at higher levels, of inducing hallucinogenic-like symptoms, of which marijuana is actually considered. It's considered or it's placed in the category of hallucinogens, even though people don't typically experience the same type of hallucinations or psychoactive effects of LSD in that sense, but they don't really fit in another category very well, so they're usually just placed in there. Marijuana is anyway. So as I said, depressants, these are drugs that act on the CNS to suppress or slow bodily processes and really just reduce overall responsiveness. And so for that reason, they're sometimes called downers. As I mentioned, alcohol, barbiturates, and anti-anxiety drugs, more technically known as benzodiazepines, are the major classes of depressants. Okay, and we can see that as you drink more alcohol, that's going to have a direct effect on your blood alcohol content level, and you can see from this table here what some of the different effects of different amounts of alcohol are, and obviously why you're not allowed to drive in most states at a level that's above either 0.05 or 0.10. So stimulants, as I said, these are drugs that act on the CNS in order to increase overall activity and general responsiveness. Hence, they're often called uppers. These are the examples that I mentioned before: caffeine, nicotine, amphetamine, methamphetamine, and cocaine. They typically act, as I said before as well, as agonists on both the norepinephrine as well as dopamine neurotransmitter systems. The opiates are drugs that are derived from opium, which, as I said, mimic the brain's natural chemicals called endorphins. They do things such as numb pain and elevate mood. They're also called narcotics because although they don't act the same way as depressants per se. They can have the effect of an overdose, for instance, of an opiate such as heroin, which is often seen in the news. It can depress the breathing in the brain, so they're not considered depressants by themselves, but they can have similar levels. The thing about these drugs is that they can be highly reinforcing because of their ability to stimulate dopamine in areas of the brain which are known to be implicated in the experience of pleasure and motivation toward seeking out a particular substance structure, in particular called the nucleus accumbens. So hallucinogens are drugs that can produce perceptual distortions. I attempted to distinguish between hallucinations and illusions, as well as delusions, in the previous chapter, when we talked about the visual and sensory perceptual systems. So some examples of these include LSD, mescaline, psilocybin, or mushrooms, PCP or phencyclidine, as well as THC, which is the active ingredient, tetrahydrocannabinol, in marijuana. Other drugs that might be in a class of their own are called club drugs. Common examples include Rohypnol, which is the date rape drug. It's known that way because it tends to have an adverse impact on one's ability to form and store new memories, and so they often have no memory of what had taken place while they're under the influence of this drug. Okay, so in terms of some healthier ways to alter consciousness, meditation and hypnosis are the other two major ways that consciousness can be altered. And so we're going to spend a couple minutes talking about these. Meditation, it really refers to a group of techniques. There's not just one type of meditation. There are multiple types. But they're really just a group of techniques that are designed to refocus our attention, block out all distractions, and they do seem to produce an altered state of consciousness. There's plenty of research to suggest that there is an alteration in brain activity as one engages in meditation, and there's also some interesting research looking at differences between people who are Tibetan monks who are experts in meditation and individuals that are attempting to meditate but not experts. And the basic premise that characterizes meditation has a lot to do with your ability to control your mind's tendency to wander. That is, if you just sit down and are not focused on a particular task, like listening to a lecture or reading a book or watching a television program. You could even be reading a book. You could even be listening to a lecture. But what you're going to find is that most people have a tendency to have their mind wander. And so meditation is all about trying to focus on one thing to the exclusion of others, and anytime you notice that it's drifting away, which it almost certainly will, you just gently bring it back to whatever you were attempting to focus on. Usually people use their breath, just paying attention to their breath as sort of the focus point for meditation. Now, in terms of hypnosis, this is another example of an altered state of consciousness, although that is a little bit controversial in terms of how much of an altered state of consciousness it is, whether it's a separate state of consciousness from our normal waking state, or whether it exists on a continuum. Okay, but it is a trance-like state of heightened suggestibility, deep relaxation, and intense focus, and it has been demonstrated through research studies to have modest success, particularly at doing things like weight loss, treating phobias, even smoking cessation, and even pain reduction, to the point where some individuals can undergo what would be normally considered by most standards incredibly painful medical procedures through the use of hypnosis without medication. And even in individuals who do take medications, those medications can be much more effective under while simultaneously using hypnosis. If we think about a well-known effect called the placebo effect, which refers to a drug's effect that is not due to its direct physiological effects, but rather is due to expectation, the placebo effect is a very, very powerful effect. And so, if we can get such a powerful effect from just being told that we might be taking a drug, then it doesn't seem that unreasonable that hypnosis can have at least some basis in that it's not just something that people have made up. It is important, however, to because hypnosis tends to be tends to have a lot of misperceptions around it. It is pretty important to just clarify a few things regarding hypnosis, because there are a lot of people out there that unfortunately will attempt to market their services in a way that is not really very reflective of what hypnosis truly is. So first of all, individuals who are under hypnosis, they are not simply just faking it. They're not just playing along with the role of the hypnotist. There's evidence that suggests that it's more than just that.